So I'd now like to introduce today's speakers, starting with Dr. Rebecca Goodhue, ARACY's General Manager Capacity Building. Rebecca started her career as a paediatric speech-language pathologist and has worked in that capacity for many years, including establishing a private practice in New Zealand, completing a PhD, and leading a team in rural remote Western Australia. Rebecca's moved into the policy, research and knowledge mobilisation space, and in her current role has developed holistic wellbeing training that has achieved international renown, and we'll be talking about that in part today. Flowing on with the presentation from Rebecca is Dr. Joe Thurbon, Chief Technology Officer and co-founder of Educator Impact. Joe's research and development career has driven innovation in climate change, health and medical research, artificial intelligence, and education. Since co-founding Educator Impact, Joe has helped improve student outcomes by providing thousands of educators around the world with data-driven insights into their practice with a focus on well-being. And we'll also be hearing today from someone using EI Pulse, Principal of St Philip's Christian College, Cessnock in Hunter Valley, New South Wales, Darren Cox. Darren is a passionate educational leader, recognised for innovating and transforming school culture and practice, including through student-led initiatives. Darren has been recognised, and I hope he forgives me for saying this out loud, as a top 5 Principal of the Year in 2019 with the AIS, which I believe is the Association of Independent Schools in New South Wales. So to move on from introductions, I'll be now handing over to ARACY's Dr. Rebecca Goodhue.
Thanks, Dale. Welcome, everyone. Thank you for joining us today. I'm really pleased to be presenting this webinar with Joe and Darren on a topic I'm really passionate about, wellbeing, and specifically student wellbeing. I'm going to discuss the concept of wellbeing first, and then move on to talking about the NEST wellbeing framework, and then provide a brief introduction on the common approach. Joe's going to talk about all things Pulse, and then Darren will describe how his school is using Pulse. Let's get into it. There's no global definition of wellbeing currently, and that's one of the reasons why there's different interpretations and translations about the concept of wellbeing. And at the moment, there's different terms that are used interchangeably with wellbeing, mental health being a common one, and particularly in the education sector, social and emotional skills or social emotional learning is used synonymously with the concept of wellbeing. And that's problematic. It adds to the ambiguity of the concept. It means that people have different understandings, and translated, it means different things to different people. It's also more difficult to measure if we don't have a definition of wellbeing. What we do have is accepted descriptors of wellbeing. So we'll get into those now. When we talk about wellbeing, we're talking about thriving, not just surviving. So it's around not just students getting through the school year without needing extra support of some type, but young people living their best lives. It's a dynamic state in that it changes both in the short term and long term, and that short term can be over a matter of a day or hours even. And it essentially encompasses that natural ebb and flow of life. And it's also certainly not about being happy all the time. It's multifaceted in that it takes an ecological frame, and it's multidimensional, and we're going to talk about the dimensions shortly. For a young person, well-being is really closely linked to their family's well-being, more so than an adult. And it's also closely linked with quality of life, and is a major contributor to quality of life. And quality of life as a phrase, we do have a definition for. Wellbeing is both subjective and objective. So subjective in the way that it's both around how the young person feels and thinks about their life, and what data we can objectively measure from conditions in that young person's life. And it's holistic. So going back to mental health and social emotional skills or learning, both really crucial aspects of wellbeing, but aspects of wellbeing. Wellbeing is a lot bigger and larger and more holistic than those particular areas. In terms of a definition, I'm pleased to announce for the first time today that ARACY is working on a definition piece for wellbeing for children and young people. And we have a working definition, which is the state of a person's overall system. By system, we don't mean in a medical sense in terms of relating to the physical body. We mean more broadly than that. So a person's system, a person as a system, would include their resources, and their resources can be things like their autonomy, their social support network. It includes the person's conditions, what they face on a daily basis. It encompasses a lot of subsystems and interconnections and those networks that feed back onto each other and regulate each other. So look out for that piece in the coming months. I'm excited to be working on that. So what we do know is how to describe wellbeing. We have a working definition, and what we're extremely across and have deeply established are the areas or dimensions of wellbeing. And this is through the NEST. The NEST is a wellbeing framework for children and young people that ARACY developed in conjunction with 150 organisations in 2012. So it's been around for a while now. It still remains valid and current. And it was done in a comprehensive process that included thousands of voices of children and young people in Australia, and as well as hundreds and hundreds of experts across different disciplines and sectors and professions who work either directly or indirectly with children and young people. It is not an acronym, I'm pleased to say, in this acronym-saturated world that we live in. The NEST was termed the NEST from one of the young people who participated in the process. It was a 2-year process for the NEST to be created, and at one of the final workshops, a young person who was attending stood up and they were discussing the 6 areas of wellbeing that I'm going to go into now. And they said, it's like if those 6 areas of wellbeing are supported, they form a nest around us, and we can be happy and healthy and then be able to fly from the nest. So what are these 6 areas? Material basics. So that includes things like appropriate clothing, your home or your classroom not being too warm, not being too cool, access to healthcare, transportation, and the such. Valued, loved, and safe. So that's including things such as positive peer relationships, feeling valued by your teachers, feeling loved by your family, being safe at all levels, being safe emotionally, psychologically, physically. Healthy is relating to both physical health, mental health, emotional health. A positive sense of identity and culture. And this is important for absolutely anyone, regardless of ethnicity or background, but particularly important for Aboriginal or Torres Strait Islander people here in Australia. Learning, and learning refers to any and all time learning, so not just learning that's happening in a formal setting. Learning, so this is where parent engagement or family engagement would come into play. And participating, so that's including young people being part of clubs or groups or society as a whole, and having a voice in decision making and decisions that affect them. So you could see as each section of that nest appeared, the other sections were strengthened, and there were gaps in that nest until all 6 areas were present. We know that all of these areas are deeply connected. Each section, each branch, each twig, if they're not there, weakens the entire nest, and when they are present, strengthens the entire nest. Now these 6 labels, they're umbrella topics. There's obviously many topics and areas that sit underneath these 6 areas, but I need to mention one of these because it's integral to every single one. and that's responsive relationships. So every single wellbeing domain cannot be fully supported unless responsive relationships exist. Essentially, young people need positive and trusting relationships to have good well-being. So I hope you can see that if well-being is translated as one or two or a third of one of these well-being domains, it is not helpful, and it's taking away from that holistic, crucial lens that we need to have. It also, if we continue to have a narrow view of well-being, it entrenches that siloed way of thinking, which entrenches that siloed way of working, which then exacerbates the issues of not seeing students as whole people that have full lives outside of the school environment and who need to have good holistic well-being to be ready and able to learn to the best of their ability. So that is the nest. We know descriptors of well-being, we know domains of well-being. How do we now implement or enact this? One way is through the common approach. The common approach is a way to talk to students and their families about well-being. It's best practice conversations about well-being. And ARACY delivers common approach training to anyone who deals with children and young people, directly or indirectly. So in a school environment, we will deliver training to front desk administrators, teachers, teacher aides, principals, football coaches, any sporting coaches, essentially anyone who could or may have a positive and trusting relationship with a student. Because we don't know what's happening in students' lives unless they tell us. And the chances of them telling us and actually having genuine discussions with us are much more increased with positive and trusting relationships. And having these common approach conversations is how early intervention or early engagement and prevention happens. The common approach, the approach of the common approach is made up of 4 practices. The first being child-centred or student-centred, and that's always ensuring that we're looking at the situation from the student's perspective. Strength-based, so looking at what's going well for that student and how those strengths can help the areas of need. Holistic, so ensuring that we are considering all of those 6 areas of well-being. And working in partnership, referring to authentically partnering with that student and any other adults who are involved in that student's life, and coming in with a power with mindset rather than a power over mindset. These 4 practices are not radical. They're generally really well known. I'm sure they're well known to everyone here today. What the common approach does is allows people working with young people to really consistently work in a way that is in alignment with these 4 practices. And one way the common approach does that is through resources. As well as a suite of resources to help adults have conversations around wellbeing with young people and their families, there is one resource within that suite that is called the question booklet for children and young people, and there's a sample page on the slide there. There's questions and statements that the student can respond to. I'll go through the examples and then tell you how these came about. So the first one is, I feel like I fit in at school. And I used this one to show that the 6 areas don't have distinct boundaries. There's a lot of overlapping and interconnection happening. And this particular statement, could be phrased as a question, could fit in either the valued, loved and safe section or the positive sense of identity and culture domain. My home is a safe place to be would come under valued, loved and safe. I worry a lot about things at school, come under the healthy domain. I have the things I need for school, would be under material basics. I can be myself at school, would be a positive sense of identity and culture question. And I have a say in decisions that affect me at school. That would come under participating. So the initial questions and statements around the common approach were created by an expert team about 8 years ago. And since then have gone through a comprehensive action research inspired process, in that every time we deliver training in the common approach, that group will generate their own questions regarding each of those 6 areas of wellbeing that we then synthesize and integrate into the question bank in the common approach. And this question bank is where the EI Pulse have sourced the questions. So I feel like I've taken you a bit of a small journey around the concept of wellbeing, through to the nest, through to the common approach, but we have now arrived at Pulse. So I'm going to pass you over to Joe to enlighten you about Pulse.
Hello, I'm Joe. I'm going to talk to you about Pulse. Thanks, Bex, for that. It reinforces to me how much we value the partnership we have with ARACY. And part of the reason we value that partnership so strongly is because I think we've got a very similar ethos, which is knowledge and questions and data are really important. But if you don't translate them into actions, then you should have gone to the movies or something else. It's until you turn it into action, you're not really doing the right thing. So let me give you a little bit of background about EI. We've been in education for about 6 or 7 years. We've been focused on student outcomes, and we've been doing that through looking at teaching practice, at giving students a voice in their classrooms, at creating an environment for staff and students to flourish. But our core promise has always been the same. And as we've moved into student wellbeing, that core promise remains. It's a really simple one. It's that we promise to deliver schools actionable insights. So we help schools collect data and then translate that data into insights that they can translate into improved student outcomes and experiences. Another part of the reason that we really value the relationship with ARACY is that we know that things like the nest are really important, because wellbeing is a really multifaceted and multidimensional thing. But what we believe we add to the equation is that it's not only important what you ask, it's also really important how you ask and when you ask. And on a lot of occasions, those have just as much impact in terms of turning data into insight. So now I'd like to introduce Pulse. It's our platform. It has been transforming the way schools are supporting student wellbeing at their school. It does it by a simple trick. We discard the traditional approach to measuring student wellbeing, the approach of annual anonymous long-form surveys, and we replace it. And we replace it by asking students for 60 seconds of their time once a week. And there are clear advantages to this approach. The first advantage is that leaders get leading indicators into the wellbeing and sentiment about the school. And that means they can get ahead of the curve of the wellbeing discussions at the school. The second is that the staff who are responsible for the frontline care of individual students, so the ones who look after those individual students day to day, they have data about those students in their pocket all the time. And the third and the most crucial is that students who are at risk or at the most vulnerable can ask for help at the time they feel like they need the help. They can do it on any device, they can do it at any time. If I was giving this talk 3 months ago, I would have been talking about aspiration and hope and desire, about maybe it works. There are about 30,000 students using the system at the moment. And so the timing of this talk is really good, because I feel like we've been delivering on that promise to schools. And so what I want to do today is share some stories about the experience that schools have had. The big thing that's changed in my head is that when we were starting this, we thought it's a bold claim to say that by asking students for 60 seconds a week, you can transform the way that schools support wellbeing. But the thing that we found truly amazing is that it's just amazing how much a student can tell you in 60 seconds. the first thing they can do is tell you how they're feeling. So each week when a student checks in, they're presented with what we call the big question. It's a really simple question. It's how are you feeling today? It asks them to rate their current state on a 5-point scale, but it gets them into 2 really healthy habits. The first is to regularly think about how they're feeling. But the second, and possibly more important, is to decide on a concrete way to share it with the people who are going to look at the answers. Most students, on any given week, it's over 99% of the students, are feeling in one of those top 4 answers. You can see them there on the left-hand side of the screen. And we'll come back to those students in a moment, but I do want to zero in on that really small percentage of students who, for whatever reason, this week are feeling at their most vulnerable. What we give to them is an opportunity to reach out for help inside the app at the point where they need some help. It's really important to note that the help they're asking for is not an anonymous "I need help" box. It's not rocking up at a help support service and not knowing who they're going to see. They reach out to a specific identified trusted teacher inside the app. So they've got a great deal of agency over how they're asking for help. We knew from the research, and now 3 months or 4 months in, we know from the data that students will reach out, and they will reach out when they're feeling sad enough and safe enough at the same time. And we also know that that time can be really fleeting. So inside Pulse, it's always possible for students to reach out, and it's always possible for students to check in. Coming back to those other students, the 99% of students who are feeling like they're managing their wellbeing okay today, they're asked 5 questions, and the questions are drawn from the ARACY NEST Common Approach frameworks. And they give the school some insight into both the cohort level student wellbeing statistics and how the students are, what their sentiment is towards the school. So how does that work? Well, every student is asked a different set of 5 questions every time they check in, and they're different from each other as well. So there are 128 questions that we've drawn from the Common Approach, and those questions are distributed amongst all of the students. The answers are combined in real time, and so the school really quickly, over the first couple of weeks, they develop a comprehensive view, not from every student, but from a statistically meaningful subset of the students. They develop a comprehensive view of what the wellbeing and sentiment is at the school. And because the data is available in real time, it means the leadership and the staff at the school can use that data to get ahead of the curve and lead the conversation of wellbeing at their school. I want to give you a really quick example of what one of the schools has done. So they've always, on a weekly basis, sent out regular bulletins to both the students and the parents, so every week or 2. And what they've started doing is having a little bit of data-driven facts in those emails. So, for example, a few weeks before the end of last term, they noticed there was a dip in the managing challenging emotions dimension of wellbeing. And so all they did was send an email out to all the students and the parents of those students saying, we've noticed as we come into exam time, people are feeling more stressed. And next week, we're going to run some study sessions on how to deal with exam stress. So that's great, but that's not the entirety of the value, right? The value is that not only do those students who are feeling stressed get a little bit of help with exam stress, but it sends a really clear message to the students. And the message is this: when you tell us how you're feeling, we are listening. And then we're going to act on what you've told us. And that puts the wellbeing conversation right in the center of the conversation at the school. I'll give you another example, which is there's another school based in Melbourne this time. They've started their in their pastoral care meetings. They all happen at the same time across the school once a week, and they're using the data they've collected through the week to lead the conversation at the school in terms of particular areas that the students might feel are salient at the moment. But then they can ask students who have checked in as feeling really positive about what it is that those students are doing to keep their state really positive. So the schools get leading indicators. The frontline staff who are responsible for the wellbeing of the students, individual students, get real-time data about those students who they're in charge of, or who they have charge of. And crucially, those students who are at risk reach out for help. And they're the kinds of transformations that we're seeing at all sorts of schools. And so just to summarize, the leaders at the school can move from a reactive stance about reacting to data that was collected a few months ago, or waiting until the end of the year till we do the next set of wellbeing surveys, and move into a real proactive stance. And it means that things get fixed before they become problems. It means that teachers and support officers who are responsible for the individual care for individual students can move from measuring and reacting again to regular monitoring. It means they can look after more students and they can provide a much greater quality of care for those students. The one that caught us by most surprise was that students moved from passengers or passive engagers in, wellbeing programs that happen to those students into active managers of their own wellbeing. And the transformation happens because there's a point in engaging. Because the schools can react on a time frame where the students can remember giving the feedback to the school, the students see value in reaching out to the schools and become active managers in their own wellbeing. But most importantly, over all of this, from a whole school perspective, wellbeing moves from a problem that we should solve into something that we should nurture in children. And if that's the only thing that happens, we can all go home pretty happy at the end of every day. So I'd like to finish with a really, really good news story, and it was one that really gave us pause inside the organisation, and it made us reflect on the importance of what we're doing. This story, it's a very specific story about a very specific school. I won't tell you the school, but this kind of story is the one that's coming through from schools all the time. A school started Pulse on, I think it was week 2 of the first COVID lockdown. And they rang us about 4 days in, and they told us that there were 2 students who were really struggling during the lockdown. And they were struggling because they knew that they felt isolated. They knew that they felt like they needed help, but they didn't know 2 things. The first is they didn't know who to ask for help. And the second is they didn't know how to ask for help. And literally on their very first check-in, those 2 students reached out for help from their classroom teacher. And what could have become a long-term problem was captured really early and responded to really early. And those 2 students are going really well. That kind of human impact is the bit that makes us understand, for us, why Pulse is really important and why things like Pulse are really important for schools. We've been working really strongly with ARACY and a few other groups over the last, since COVID started. Part of what we're doing is making Pulse available to any school in Australia on a pay-what-you-can basis until the end of this year, when hopefully we'll have a vaccine and things go back to normal, at least a little bit normal. Things will never be the same again. But we know that the rest of this year is going to be really hard. And because of support from ARACY, groups like the Flourish Movement and groups like AWS, we're able to make that available to schools on a pay-what-you-can basis till the end of the year. I'd like to move on to talking a little bit about Darren Cox, not very much because I don't want to embarrass him, but Darren and SPCC have been part of the EI family since we started. And I think it's just recognition for Darren, some of the awards and so on that he's received. He's truly a pleasure to work with. He's an innovator, and that suits us fine. And I'd really urge you to listen most carefully to this bit because he's terrific as well. So thanks, Darren.
Thank you, Joe, Dr. Thurbon. Really appreciate your kind words, and good afternoon, everyone. Great to be with you. And if I was to start a brief conversation with you and I say how you're feeling today, I'd pretty much imagine that most of us would answer with the word fine. And it's human nature that actually oftentimes it's a daily question we ask so many people in our world is, how are you doing? And the answer we get back is fine. And really, we don't know what fine means. Fine means, yeah, I'm fine. I'm kicking goals, or actually I'm not doing that great, but fine seems to be a safe answer. And so too often in school context, what really occurs is in our pastoral care time, in our pastoral care programs, teachers are really asking kids, how are you doing? And the answer you get back is fine, and we don't really get the opportunity to go too much deeper than that. And so at the end of last year, I started the conversations with Joe and the team there at EI about the Wellbeing Pulse that they were talking about. And so we plan to actually start at the beginning of the year, implementing at the beginning of the year anyway, and so we really got a little bit of a brief run-in before COVID lockdown hit. And so what ended up happening, instead of us just trialing it with a couple of grades, we then rolled it out to the entire school population really very quickly. One of the beautiful things about EI Pulse is just how easy it is to use. I am really, I'm not great on technology, but this EI Pulse is just so easy to use. It is literally 5 clicks of a button. On the images that showed up there, it's an app that looked like it was on a phone. At our school, all of our students have a device, and so they actually just log in through the web. So they get an email, and then they just click on the link from that, and that takes them to web pages. And so at our school, the kids aren't using it yet on their phone. They're using it through the web, and we'll be working towards that soon. But it is just so accessible for the students, and I think that's what makes it a really great support program for us to use in the school. Is that too often in schools, if you're not doing wonderfully or you want to talk to someone about well-being, there's a counsellor that exists, and often that counsellor's room is down the end of a really long corridor in a part of the building that students often don't go to. And so it makes it really awkward and inconvenient, and it makes you stand out somewhat if that's the room where you're going to end up going just to talk to someone about how you're doing. And students, especially teenagers, are often highly unlikely to do that. And so the data that we've been collecting through the annual once-a-year sort of well-being survey that's been put out by different organisations would reflect the numbers of students seeing the counsellor hadn't been that high. And so we needed to work out what we could do in that. Some of the things we have done is trained more staff, which gave the kids more accessibility for staff who are in their day-to-day life. But then the Wellbeing Pulse means that actually they don't even need to start with a conversation. They can start by clicking a button. And the students we know are happy to engage on technology. That's their world. They're happy to do that. And so they can sit there, and at any time of the week they can click on the button. One of the things that we do at school in our implementation of EI Pulse is that they get a reminder email on a Tuesday afternoon, they get another one on a Wednesday morning, and then Wednesday morning in their pastoral care time, they're all encouraged to go on and click on then. So they're encouraged to do that once a week, but by all means they can click in more regularly, and there are some students who click in almost every second day, just to click in, say, yeah, I'm doing great, or I'm doing okay, I'm feeling super positive, or I'm feeling a bit negative at the moment. And there are other students who just click on that once a week in that pastoral time just to let us know how they're tracking. And so it's great that they can do that in that space without having to put their hand up to say, oh yeah, I'm not doing that wonderfully well, or they've got to leave their friends while they're sort of enjoying their lunch break to walk down a corridor to tell someone they're not doing that well. They can do it right there and then. On the lowest, number one, if you click on feeling I need help, as a school, what we did was identified key people in the school that the students then can connect with. So if they click I need help, there are a select group of staff that come up, myself, the deputy, head of school, head of wellbeing, year leader, and the student can then click who they actually want to talk to about that. And then the teacher, the staff member, actually makes connection with the young person. As the school leader, I get a weekly report on how students are feeling, and then I get reports on where they've clicked according to the common approach questions there as to how they're connecting with school and engaging with others, etc. Gives me a chance to see how different grades are tracking, how different groups of students are tracking, and also gives me a picture of the whole school. In there, I also get to see that if students have clicked I need help, I get to see who they identified they wanted to request help from, and then I can see if that staff member has actually actioned that help. And so there's all these sort of levels of accountability, so it's easy for the students, and then there's accountabilities that actually that is being followed up. One of the challenges that we currently, we're just working through some process, is if a student clicks I need help and it's actually out of hours or it's on a weekend and we're not going to see that student again till Monday, what can we do in that space to make sure they feel heard, to know that actually they've reached out, we've heard that? How can we actually work that in those sort of out of hours times is something for us that we're still working through some process on that space. The reason I chose Wednesday morning as a time to do the check-in was because, to be honest, I don't even feel great on a Monday. And so I didn't want to do it on a Monday. And Wednesday sort of feels like you're a little bit more optimistic because you're in it for a couple of days and the end is only a couple of days. And so I did it in the middle of the week for those reasons. And it also gave us the opportunity that if someone said they needed help, we actually then had a couple more days to action it. Whereas if I had all the pastoral care teachers do this on a Friday, and a student said, I need help. We've got a shorter window in which to provide some supports to them, both internally and externally. And so that's the reason why, as a school, we've implemented it on a Wednesday. Similar to a number of the stories that Joe shared with different schools and some of their different positive experiences, for us, it's been incredibly positive. We have had students who have reached out for help that have otherwise not seen the counsellor before. And so actually now reached out and have been able to really meet the needs of students that previously we didn't actually know, because I actually hadn't even seen the counselling group or the wellbeing team. So for us, that's been a huge positive. It's been able to help us shape our wellbeing programs. And so, you know, wellbeing is more than a program. Wellbeing is about a heart of support and encouragement for young people and for the staff in the school. And so in our pastoral care times, we have programs that we've written that we think are going to meet those needs. But then if we're getting feedback that says about the stress, like the story that Joe shared, well, then we can actually do that. We can change it up. We can change it up really quickly, and we can be really agile in actually how we're going about meeting the needs. And so that real-time feedback has been wonderful for us. One of the other things that we try to do is, if there are students who have reported back that they're feeling really positive or they're feeling outstanding, teachers also talk to them about, oh, why is that? Or how come? Or what's going on for you in that space? So that those students in that pastoral care time can actually identify why they're doing so well. And maybe some of those who are feeling a little negative or a little neutral can actually hear what some of their strategies are or some of their approaches are. And when it comes from a peer, it seems a little bit more real, rather than an adult telling them what to do in order to gain those healthy wellbeing habits. And so we've been able to use it as a peer-to-peer type of encouragement for the young people as well, which they've greatly appreciated in that space. The fact that it's so accessible, the fact that it's regular has been, it's not just something that they're going to click on once a year. And some of those surveys were 40 questions long, and we found that students just started clicking random boxes. I used to be that student, by the way. But what they do now, because it's meaningful and it's engaging for them, they just 5 clicks and they're using it all the time. And what we try to do at school is we try to take things from being just a program, something you have to do, to actually this is a life skill or this is a life habit. So at school, one of the things we implemented a couple of years ago was a physical fitness program. So I actually kitted out and built a full-on corporate gym. And so every student now, as part of their PE program, has 2 or 3 fitness sessions a week. And interestingly enough, they engage a lot more in that space than they do in the PE class, where they're playing volleyball or basketball or something, because actually it now goes from just being an outcome that needs to be ticked off that's going to be on their report card to actually now something which is a life habit. And that's what we found in our approach to fitness. And this is what we're trying to do with the wellbeing, our approach to wellbeing as well. This isn't something you do because you're at school. It's not something you do because it's a school program. Actually, we all need to continually look after our wellbeing. And one of the ways we do that is by having a check-in with different support networks that we have around us. And so we're encouraging the students to engage in it that way, so it becomes real rather than just something you have to do because you're at school. And the students, the engagement levels are just fantastic. And the feedback from students, the feedback from parents has just been wonderful, that they know that there's a school that is actually so keen to hear so regularly from their young person, not just on how they're feeling, but actually it drills down further into their family life, into their physical needs, into their school connection, into their peer groups and things. And so the feedback from parents has been overwhelmingly positive, that a school would actually do something like this to show that they're invested in the lives of their young people. And so they've been really positive on that as well. And then what we're also able to do when we're hearing different aspects there of what the students are feeding back, similar to the bulletin idea, we put things on our websites and give out some parenting things as well, parenting articles and videos they can look at and access. And so the parents have actually then got a way of supporting them at home. So it's now just not a school-based, thing to look after. It's actually now relationship between school and home. And so that's been overwhelmingly positive as well. And hopefully as a school, it talks there in one of the slides that Joe showed about actually being prepared and being proactive. And that's exactly what it does. It gives us a chance to be proactive into that space, that if we're seeing someone's tracking maybe in the negative, we can actually talk to them. We don't only just engage with students who have reached out and said, I need help, but also those students who are showing just a pattern of feeling negative, we can actually engage with them as well. And so I would highly recommend it. It is easy. and staff have found it usable, user-friendly, which is great because staff and technology sometimes don't go hand in hand. So I can't recommend it highly enough for other people to engage with. So that's been our experience up here in the Hunter Valley, and I trust you are all doing well as we begin a new school term in whatever field you work in. So thank you, Rebecca.
Thanks so much, Darren. It's fantastic to hear from someone who is using it in real life. And thanks, welcome back, Joe. So we've got many questions that have come through. We'll get through as many as we can before we need to wrap up. There are a few themes coming through. So we'll start with, people are asking a lot about how does it work with the consent procedure and parent permissions, and do parents opt in, and how does that work, and how have you handled that side of things, Darren?
Joe, do you want to talk to any of the background re privacy at all in that as well before I answer what I did at the school?
Yeah, absolutely. So I guess the kind of admin side of it first. So we obviously comply with the Australian privacy regulations. We also comply with the European privacy regulations, and so we've got all of that stuff sorted out. On an enrolling a student into the program perspective, different schools are doing different things. At one end, they're getting explicit permission from the parents in the form of some sort of email that comes back. At the other end, and this is a fine thing to do, at the other end, just informing parents that it's happening and letting parents opt out. But there's also a consent screen that the students click through as well, which tells them in child-friendly language what we're going to do with their data. So we've set up the system to be have a privacy posture, if you like, of not sharing very much of the student's data. And in particular, the only thing that gets shared with the school is the answer identified is the answer to how you're feeling, and then also the fact that a student's reached out for help.
Yep. So the way we talk to our parents was really around, this is just an extension and a way that we can actually ask your students how they're feeling, because that reason that Joe said, we don't see the specific information regarding the other questions. And so we would ask students how they're doing anyway. And so the parents know that's a big part of our school. It's based on relationship. Wellbeing is about a heart for people. And this is us just reaching out, and we said, this is how we're going to do it. And we haven't had one parent. And so our school is now, we're at 1,100 students in our school now, and we haven't had one parent opt out.
Excellent, thank you. The next theme in terms of the questions coming through is around the age of students who are using Pulse. I'll start off by saying, in terms of the common approach, because the common approach is a conversational approach, we are saying that if people are using common approach resources like the question booklet, then they need to be around 9 or 10 years of age, because we know from both research and practice that under that they need an adult to work through those questions. In terms of the literacy, which has been part of some of these questions around the age, how is Pulse handling low literacy issues? I wondered, Darren, if you could speak to what ages of the students.
Yep. So we initially were going to implement it up in a secondary school with a couple of grades that we thought was sort of fairly solid years for them. However, then when we started that, then when COVID came along, we actually then rolled it out to everyone in years 5 to 12. So 10 years old all the way up. And there hasn't been any feedback in regards to not being able to access it because they're not able to comprehend or read in that space. So that hasn't posed itself to be an issue for us, and we use it, across years 5 to 12.
Excellent, thank you. And on that, do we have any data around what the take-up rate is? So
I could also add to that, Rebecca. Where our school is situated is actually in a low socioeconomic area. And so literacy levels are quite low, and yet our students in that space have still been able to engage with it as well. So just to give a bit of context for people there who may be questioning where they are, attainment levels in Cessnock are fairly low, and so we've been able to meet that, and hasn't proved to be a problem.
Great, thank you. The next question that flows on for that is, so all students are offered this if there's no opt-out from the parents, and do we have any data around the take-up rate from both a school perspective level and Joe at a more higher level for Pulse in general?
Yeah, we do. And so this has been one of the really interesting things. So we've obviously we get data across a lot of schools, and we've learned a lot about how to roll it out. So what we noticed was that there were two cohorts of schools, one of which had sort of month-to-month engagement of their students well above 90%, and another sort of cluster of schools around the 60 or 70%. And so we went and talked to those schools and found out what the difference was, and it's actually really simple. If you create a little bit of space in your weekly routine, you don't have to make it mandatory, but if you make a little bit of space for the students in their weekly routine where it's there's time to fill it out and they're encouraged to fill it out, but don't have to, then you move your school from the lower cluster to the higher cluster in terms of engagement. It's a really simple trick. But it seems to work really well. And so what we tend to see is that not every student will check in every week. So you can expect sort of 70 to 80% weekly check-in, and that ladders up though because it's different students checking in every week. So on a month-by-month basis, you'll get 90, 95% of engagement there. That's not at every school, and we keep on working with schools individually to try to work out how to increase the engagement over time.
Thanks.
Yep, so we've been able to track our engagement levels, and it varies from week to week. It varies from grade to grade. There are some students, so for example, my boys at this school, my three kids are, and my boy hasn't clicked in once, he's year 9. And I said, mate, how come? And he goes, oh no, I'm happy, I'm feeling good, you know, I'm doing school, I'm all right. And so he just hasn't felt the need to. And so the guy who's responsible for trying to implement it, his own son's not clicking the box. So that's what there's a suggestion there that some of those students who don't feel as though they've really got a whole lot to say, they haven't, but we do carve out time on a Wednesday morning in our partial care program, and that definitely sees an increased uptake in people using it.
Great, thanks guys. There's a question around what training is provided to teachers who receive the reach out, the request for helps. I would like to start off answering that, saying that is where the common approach comes in. So we would highly suggest schools to explore implementation and adoption of the common approach. And as I said earlier, that's for absolutely anyone who might be having a relationship and talking with children on a regular basis. So Darren, did you want to speak about what you've got set up?
Yeah, so a couple of years ago, what we did was we moved away from just having a single counsellor to a wellbeing team, and that's year leaders, faculty leaders, et cetera, in school context. And the idea there was to train up as many of them as we could. And Rebecca and I have had conversations about further training for our staff across the school in regards to the common approach. We've done things like the accidental counselling course. We've had Lifeline out here. We've had BU out here. We've had solutions briefed focused therapy for staff. And so what the idea is to upskill as many as we can to be able to deliver triage, for want of a better word. And then if that's able to be met within sort of, 3 to 4 conversations with a person, great. If it feels that it needs something, there's a lot more going on, then we would outsource that to external agencies who are a lot more trained than us. But so we've raised up a whole lot of staff to a level, but then we leave the expertise to the experts. And so that's when we would then outsource that if needed.
I should just very quickly point out, Bex, there are 2 roles in the system for staff. There's principal role, but then for staff, you can either be a staff member who's responsible for a class, but is not a target for reaching out for help. So some schools are saying if their teachers have less than 4 years experience, then they're in there to see the data, but they're not available for direct reach out. And then the more senior teachers are the ones who the students can reach out to for help. And so we work with the schools to help on board to make sure they're building their structure up for success from the beginning.
Yeah.
Great, thanks, Joe. Okay, next questions regard cost. What is the cost for schools, and is it absorbed by the school?
Joe. Have I got a deal for you? Come on, Joe.
We should have sent the salesperson.
Yeah.
So reminder, it's free, or it's pay what you can until the end of the year. The precise cost depends a bit on the school sector that you're in, and whether you're in part of a network of schools. So it's not always a straightforward answer. But if I can anchor our dear listeners at $10 per student per year, that's the sort of list price for an independent school.
Good. And another theme that's coming through in the questions is around evaluation in terms of what is planned or what has happened regarding the effect of Pulse on wellbeing. And that's something that Joe and I have discussed, that ARACY are very keen to be involved in the planned evaluations. And I know, Joe, you're doing things within Educator Impact in this space as well. Did you want to speak to that?
Yeah, absolutely. So since we've started, we've had research we provide data to independent researchers. So we've had research done by the Grattan Institute, a number of universities and so on. And that's exactly what we want to do now. People should be really suspicious of organisations evaluating their own programs. And that's a fair thing. So we've almost, I don't know if we've signed it yet, Bex, but we're putting an agreement in place with ARACY, because obviously you represent a large number of research organisations, and we'll just make the data available to the researchers and let that happen on that basis.
Excellent. Is there a Pulse for teachers?
Yes, it launched on Tuesday. So we also work with the Flourish movement, who have made a huge difference to the lives of principals and staff in terms of staff wellbeing. So we've had a similar relationship with ARACY we have with the Flourish movement. So staff wellbeing, teachers and the rest of the staff at a school can use the same sort of thing.
Great, thank you. A technical question, can the system handle shared devices, and how does this work?
So yes, it's a web app. So the idea is students at the end of a check-in are automatically logged out within 30 seconds of finishing, but there's a great big log out button that they should click at the end. In an environment where the devices, so it's designed for an environment where devices are shared, but we still suggest that people use their own devices to use it. So we've taken all of the steps that we can take to make it secure, but it relies on, as best we can, logging people out automatically. The reason there's a 30-second timeout is if the students have asked for help, then while they're waiting for that help, we provide resources on the logout screen saying, well, you've asked for help. If it's urgent, the teacher will get back to you as soon as they can. If it's urgent, you should contact, well, depending which state you're in or which country you're in, Kids Helpline, eHeadspace, etc. So we leave it at least enough time for them to click on those links before we pop them out of the system.
Great, thank you. I think we've covered most of the themes. Well, there's a few questions around children that don't have access to the internet and or devices at home.
So it's designed predominantly for in-school use. We do make it, students can check in anytime they like, anywhere they like. But yes, the basic design is that it would be used as a part of the school day. The reminders are scheduled to go out during the school day. We strongly encourage schools to provide a little bit of time through the day to use it.
So we're in a regional setting where large numbers of our students are quite remote and don't actually have internet at their property, but we do it during school hours on that Wednesday morning. But having said that, we're also fortunate enough to have a one-to-one device for all the students in our school.
Great, thank you. And I think we've covered all our questions. There's just so many. I'm just checking that we have answered all the themes. Are there any last parting words from either yourself, Joe, or Darren?
Look, I suppose for me, it's been a really personal journey for me as well. My wife is a clinical lead at Headspace, and COVID really brought home, literally brought home, the importance of these sorts of wellbeing apps, because Rose was working in the room next to me doing telephone assessments. I'm really passionate about it, and so I would encourage. The data that we're getting back from schools demonstrates that it works. And so, you know, I feel no internal conflict in recommending that people get started with it. I think it's a really good.
Wellbeing matters, and if it's one life, it matters. And wellbeing is more than a program. And so this is not a program that we've got out of a book or whatever. This is actually just a way of us connecting and engaging and hearing student voice. And ultimately, that's what matters the most in students, young people's lives. So, yeah, it's fantastic.
Great. Thank you so much, Darren. Thank you so much, Joe. I hope everyone's found this valuable and interesting and enlightening. There are a couple of email addresses on that previous slide for both ARACY and Educator Impact if you're interested in either the Common Approach in the Nest or Pulse as a platform. And as Dale mentioned, this will be available online as a recording, so share it with anyone that you may think may be interested. Thanks everyone. I'll pass back to Dale to finish up.
Thanks again to our participants, Joe and Darren, and thank you to all of you for signing in today. There are a couple of outstanding questions, so we'll send those round to the panel today, and we'll publish a document on our site next week. Thanks very much.